Hello, everybody. I'm Zachary Pohl, Ecosystem Principal at VSP's Global Innovation Center. At VSP, our purpose is to empower human potential through sight. As the first national not-for-profit vision benefits company, this is what drives everything that we do. For 70 years, VSP has been a leader in health-focused vision care. The Global Innovation Center is VSP Vision's lens into the future. Through emerging technologies, new business exploration, and strategic connections within the innovation ecosystem, the Global Innovation Center is a hub for reimagining the way eye care and eye aware are delivered to the world. This is the fourth in VSP Vision's Lens into the Future event series. In the link provided, you will see the microsite to see the entire series that we've done so far from last year. The future of diagnostics, the future of wearables, and insights from the HLTH conference. This fourth one is on the healthcare provider influencer and their role in the future patient's journey in their healthcare journey. We chose this topic for two reasons. Number one, we highlighted it as one of the major trends in our most recent Futurist report, which specifically goes through the future patient healthcare journey and the five trends shaping that. That link, if you want to go deeper in there to see the others, is currently being provided. But we chose it for a second reason as well. We really wanted to highlight this trend because we saw it as an opportunity for providers to be able to grow their practice and foster deeper patient connections. When I was meeting with the speakers that you're going to hear from, this is how they're leveraging social media to be able to have deeper, more rich conversations that they'd love to be able to have with their patients, but they don't currently have within the practice of the clinic in which they practice in. And then also to be able to battle misinformation and really be able to be a platform for their entire practice to thrive. So, with that, I'm so happy to be able to bring on our first speaker. But before I do that, Dr. Rhue, as you bring on your camera and unmute yourself, we understand that a lot of people in the audience are entrepreneurs, solo founders, and you might not have vision benefits. And so you can click the link that's being provided here to be able to see our direct consumer offering if that's valuable for you. Dr. Rhue, great to see you.
Thanks for having me, Zach.
Yeah, you're welcome. So Dr. Rhue is a board certified optometric physician and a recognized leader in myopia management and dry eye disease at West Broward Eye Care Associates in Tamarack, Florida, which is outside of Fort Lauderdale. She specializes in myopia control, keratoconus management, dry eye treatments, and advanced ocular disease care. She's a frequent lecturer and principal investigator in myopia research, and she's passionate about leveraging technology to improve patient outcomes. Did I get everything, Dr. Rhue?
Yeah, and co-founder of a tech company, but
And
you
co-founder of a
got
tech
it.
company. Right. Yeah. So let's start from the beginning, Dr. Rhue.
Yeah.
What made you decide to start building a presence on social media, and what results have you seen since?
So I really decided to do this about, well, it always started. So when I joined my practice in 2010, all of this was still very new. Facebook was coming out, Instagram was coming out, LinkedIn. I look back when I joined LinkedIn, it was in 2010. I don't think I posted till very, very late after that. But when I joined the practice, we were on paper records. We had to choose what EMR to go on to, and reviews, Google reviews were a big thing. So we went with a company that actually sent reviews to patients, and now we're over 500 reviews at this point, with the clinic up the street having maybe 26 to 27 reviews. And so I knew very early on that's how patients were finding us. Now, this has become my business card to leverage what I've done and all of these seeds that I've planted. And this is one of the reasons I'm on this call, is to now leverage that, not just for yourself, but for the community that you serve. And I went all in about a year and a half. They call it going pro, which now all you're going to listen to all these pros on here. And it's become my journal. So it's not about the likes, it's about really your journal, it's your journey. It's seeing one patient or one person as another clinician that saw it and motivating them. So it's become quite an adventure. I had a rep come in yesterday and she's like, oh my God, I'm fangirling over you because I've been following your journey for a year. And I told my colleague who I was going to go get to see today. And it just, the conversations that you get to have are just so exciting. So it is fun.
That's great. And having fun is so important. Also, I did forget to mention at the top just how this event is going to run. We're going to have 5 10-minute conversations. So you're the first, and then we're going to have four different speakers. And then so that's how today's going to run for the audience. I forgot to mention that. But going back to having fun, which is so important, especially as we see, having fun is probably the best way to be able to cure burnout. And pretty
Yeah.
much the opposite. What are those conversations that you're having that are so fun that you're able to have, and be able to provide better care for the patients?
Well, what it's allowed me to do, so going from seeing patients day in and day, so my goal was to always own a practice. And then I started dreaming bigger and reading books and now launching a tech company, Doctor Contact Lens, for a need that we needed to help patients connect their eye care all the way back to their physician. So eye care is very specific that I will prescribe you something and then you're a patient in one part of my practice, but you're a consumer in another part of my practice. So
Yeah.
it's not that you get to go to a dentist and they prescribe a root canal and then you take that root canal and go somewhere else. Eye care is very transactional at one point in that visit. And so that's what we solved in the tech company. So what it's allowed me to do is go from being a physician to now a vendor. And I love helping doctors see that, realize that you are the shark in Shark Tank. So as you're going to an exhibit hall, and anybody, any physician listening, realize that you're the shark. If everybody's pitching you all the time,
Yeah.
a rep comes in or a patient comes in or your 4-year-old, right? You have to be the shark, which means you're asking better questions to move your business and your practice forward to take care of your community.
And that's what first thing I was so happy to be able to start with you because you're an optometrist who's done such a great job at not only providing great care, but then you have a practice that thrives. And so being
Mhm.
able to highlight that is so important for us. Can you give us one specific metric in your practice, whether that's patient acquisition, retention, or revenue, that you can directly trace back to your social media presence?
Yeah, the social media thing is very interesting. As you do it, the people that are liking your posts are other physicians at first, right? So there's not a lot of patients that are, top of the mind, always thinking about their eye care or emergency medicine or a pediatrician visit, right? When something comes up with your eyes, you go in, you see it, and hopefully you don't have to think about it for another year. Don't let that deter you. You're not doing this for the likes. You're doing it to maybe that one person helps you. And I always ask people how they found us. So a new patient, how did you find us? When they go search, let's say VSP, then they'll do a Google search and they'll find, or a chat GPT, find an eye doctor near me that's open on Mondays that sees kids and takes VSP. These are very specific things that patients are asking. And you have to be seen. It's your new business card. They want to build rapport with you before you already come in. We're launching something where when a patient gets their reminder to come see us, they'll actually get a little video inviting them in, which makes sure that they're actually now ingrained in their care to live longer, to live better, to have vision throughout their whole lives, because we have to fit so much in that one little visit. And what's interesting, Zach, is Dr. Contact Lens actually would not have ever been born, but it was a patient that came in and said, I go, what do you do? And he's like, I'm a developer. And I was like, wow, I need one of you. And that's where Dr. Contact Lens was born. So you just never know where these relationships will take you. And I had a patient came in, I went to University of Arizona, and he picked me because and that's like in my bio, way like in the bottom of LinkedIn. And he's like, yeah, I mean, Arizona's cool. That's why I picked you. And I was like, oh my God. Glad that education paid off for many, many reasons, but they want to know you. People do business with people they know, like, and trust. And with all the misinformation out there, it's more important than ever that you as a doctor have a voice.
So, one last question for you, because, and we highlighted this in our futures report, 42% of physicians are actually following other physicians on social media and interacting with them, and they're finding that valuable. Is that something
Yeah.
that's also happening with you? Are you interacting with them and getting value?
I mean, my LinkedIn, my Instagram, all of it teaches me.
Yeah.
So when I knew I was on here, I went down the rabbit hole of all these amazing physicians on here. And I also look to, we all have, I remember in optometry school where I went to Nova, there's 12 different professional schools under that. And guess what? They color coded us. We were green, dental was blue, the MDs were a different color, pharmacy was a different color, but we're all in the same field. We all want the same for the patient. And as you look at the different verticals, it's very similar. So, optometry, I'm constantly looking to the dental industry. I'm constantly looking to the um, dermatology business, is very similar to what we do in optometry.
Yeah.
And that's how I figure out what's coming forward because those communities are probably 5 to 10 years ahead of where we are. So if you get this little lens into the future to see what's coming by looking at other verticals. And then you have more to talk to your patients about as well,
hmm that's
especially in eye
great.
care, because your eye is like everything else. And we became somehow your primary care doctor. It's unbelievable.
Yes, yeah. In one of our previous features reports is on oculomics, being able to use the eye to be able to detect whole body health issues, and we see that continue to grow as a field, being able to detect neurodegenerative disorders, cardiovascular risk, kidney health, um, metabolic health. We spoke at the HLTH conference on it. Will Flanagan on our team, there are three separate talks on it. So we're just seeing more and more momentum going in there, which is so exciting to be able to see. And our innovation challenge is actually featuring one of those companies, Ultras AI. So we're so excited to be able to have them. Um, one, and that's to go back to something though that's so interesting that you're using social media to be able to interact with physicians in other specialties. Because when you go to conferences, a lot of the times they're specific to your specialty, right?
Yeah.
So and we see that a lot too. We look to dental, we look to derm, we look to PCP to be able to get inspiration for what we can bring to optometrist's office. So that's really interesting that you do that. Um, I want
I've
to,
actually gone to other conferences too. So, like, I've gone to a dental conference, I've gone to an audiology conference.
yeah.
So, it's about getting yourself in different rooms. And that's also what this has allowed me to do as well.
So if you had one minute to be able to make your pitch for why other specialists and optometrists should be utilizing social media or other means to be able to help their practice, how does it help your practice? Why should they be using it? And how's that going to be valuable in the future? What would it be?
My pitch is you have a voice, you need to share it as more misinformation is coming out. It's frustrating when a patient comes in either terrified by a condition or they then don't believe you and want to go do more research. So I think it's helping get your frame around how you want to be represented in your profession, how you want to be represented in your community, and really being a staple of a community because it is one patient at a time. So that burnout that everybody talks about, it may be the millionth time that I've described dry eye or myopia management to a patient, but it's the first time they're getting to hear it. So it's using this very creative side of your brain to get it out. So as high performers, it helps elevate your leadership style as well. So a lot of us graduate, being a leader because you have the title behind your name, but we haven't graduated to that next leadership side. So go down the rabbit hole, start posting. Only 1% of people post on LinkedIn, Zach. Wide open real estate, guys. Wide open. And I haven't missed a day since actually January 31st of 2025. It was a deal I made with myself. I got a coach and I literally went all in. So consistency in anything that you do. And then you get to see these cool people come up and support you and rally, and you really find your tribe.
That's fantastic. Dr. Rhue, we are unfortunately out of time. Thank
Yeah.
you so much for joining us. Dr. Rhue, though, did give us a fantastic segue to our next speaker. So, Dr. Durrani, if you want to turn on your camera and unmute yourself. Dr. Durrani is a board certified emergency medicine physician in Houston and a nationally recognized medical analyst and speaker. He is the host of STEM City, a television series that introduces young audiences to real world STEM careers, and he uses social media and storytelling to amplify evidence based public health information, health equity, and innovation in medicine. Dr. Durrani, how are you?
Good. Thanks for having me. Excited to do this.
Yeah, of course. Same. So glad to have you. I know ever since we started following each other, I've been seeing your podcast pop up, which has been fantastic. And I've seen your clips on CNN and so many other channels. So such a pleasure to have you.
Yeah, excited to be here. I'm feeling motivated after Dr. Rhue's talk.
Good, good. Very glad to hear that. So the first question that I have for you, Dr. Durrani, is you're an ER physician and you take care of patients in critical moments every day. And you've also built a significant presence online focused on battling misinformation. This is why Dr. Rhue's ending was such a great segue. How does being online and combating misinformation connect to your core desire to improve patient outcomes as much as possible?
Yeah, I mean, Dr. Rhue said it perfectly. Burnout, if you look at like any of the list of like specialties and various places in healthcare, emergency medicine's like always top three. And one of the reasons for that is, there's a bunch of reasons, but one of the reasons is we keep seeing the same thing. And it's frustrating when you see decompensated diabetes or decompensated eye disease or whatever the case may be. And you're like, man, I'm just putting a Band-Aid on this. And I know that this patient is going to be in the hospital for a few days, get discharged, and they're probably going to end up right back here in a few weeks. And the funny thing is, like most of us in emergency medicine went into it because we didn't really want to focus on preventive care. We wanted to treat the acute thing. And then most of my colleagues, when I talk to them, they're like, man, maybe we should have focused on that, or I wish that was a component of our practice. And so for me, rather than becoming just constantly frustrated by it and feeling like, hey, can't do anything about it, that was kind of a way to kind of get ahead of it. And so basically saying like, hey, if you are on diabetes medications and you take them, you're probably not going to go into DKA, or here's the signs of DKA and how you can come in early so you don't end up having a 2-week hospital stay and it could be a quicker stay. And it kind of I think back to this example, and actually wrote about this at length a couple months ago. I literally had a patient who had seen like a video on TikTok, and they'd seen that cinnamon and some other kind of mixture was like a remedy to like cure your diabetes. And so they stopped taking their insulin, they stopped some of their other medications and started doing that, and then they came in DKA. And it's hard to stop or kind of push back on that level of misinformation in that like 10-minute encounter I have with that patient, because I got like a trauma coming in the door. I got nurses calling me about critical lab results on other patients. And so having to see that, day after day, my way of combating that is getting on social media and basically translating the things that I'm seeing in my day to day to social media and saying, here's how you can avoid that. And, just kind of starting there.
Such a great passage that you gave us. We actually had, as part of the Innovation Challenge last year, Dr. Stuyvesant. He was an ER physician in New Mexico, and he had the same frustrations. And that's actually why he started his company, Vitazi.ai, which utilized oculomics to take an image of the eye to identify cardiovascular risk because cardiac events are so common in ERs. I want to go down a certain segment with you. You talked about your purpose and why you decided to get into medicine, and you're on the acute care side as an ER physician, which is really hits one point, but then you and other physicians see an opportunity to have a bigger stage to being able to help on the preventative side. Can you talk about how being able to do this is helping you have those deeper connections through those preventative conversations that you're having?
Absolutely. So and I've realized that I'm like, 4 years out of residency, and you come out of residency, you're like, okay, I kind of know what I'm going to know. And obviously I'll keep up with the emergency medicine literature, but, I don't have to like really, focus on OB or focus on that thing. But I've learned that through kind of this passion that I've developed of, making sure that I put out good information that kind of prevents these emergencies, dispel bad information, that I do need to know more about vision care and OB care and cardiologic care that comes before the reason we go into ER is like we get to do the 15 most exciting minutes of each specialty, but I'm realizing more and more as I'm getting further out of residency that there's more to it than that 15 minutes, and I need to know more about that. And so for me, it serves as a way to educate myself. And so the previous speaker kind of mentioned how she connects with other specialties and other kind of fields in healthcare. And similar to me, I will follow, people who are family medicine physicians, people who are OBs, cardiologists, and I learn from them. And then, they may mention something, and then I'll like actually go to the literature and see, hey, what this thing that they mentioned, is it actually ready for prime time or not? And do some of my own kind of, deeper dive on it. But a lot of times new ideas from new specialties will come onto my radar from social media. And so it's exciting for me where, sometimes if you look at my screen time for Instagram or LinkedIn, it's scary. I'd rather not share it, but I justify it by some of it is
Right.
me honestly being exposed to like new ideas that wouldn't come onto my, radar if I just focused on emergency medicine. And then kind of, teaching myself, which is exciting. I'm someone who's always curious about a whole bunch of things within healthcare and outside of healthcare. And so social media serves as that conduit of being exposed to new ideas within healthcare and then kind of seeing what comes of it.
That's great, and that's a great lead into the next thing that I wanted to be able to get your perspective on for the audience. You've built this following that has over 33,000 followers, and you've appeared on CNN, MSNBC, NBC, and others. What have you learned about how to communicate that complex medical information in a way that actually lands with people and gets them to act on it? Because we know that the latter part is such a challenge.
Yeah, so it comes from practice, and so it started during the COVID pandemic. I accidentally ended up on the news, and then ended up on another channel. Another channel kind of snowballed, and what I realized was, if there's like any, folks that are, younger in their careers, maybe a med student or resident, a lot of them reach out to me saying, "Hey, I want to get involved with social media. What are some tips or tricks?" My first kind of advice is, know what you're going to talk about cold, right? So like if you go into a room, like these news segments are like 3 minutes, right? And you don't think that, oh, I just need to know 3 minutes worth of information to either be on the news or create a 60-second reel. Know that if they put you there for 45 minutes, you could talk about this topic for 45 minutes. So whatever you want to talk about, whether it's on the news or whether it's a social media clip, know it cold, know everything about it. The flip side of that is that the person, whether they're looking on their phone or whether they are flipping through the channels and they see you there, they honestly don't care about the details. You should know the details, but they don't care about it because they want to know how it's going to impact them. And so my kind of formula for whether I'm creating a reel or prepping for like a news interview is always, have the foundations down. If they ask me a question out of left field, I could totally answer it, but bring it down to 3 points of like, how is this going to impact me, right? So if I get the flu, when can I go back to work? When is it safe to go back to work? If I exposed a 6-month-old in my household, should they see a doctor? Should they, be put on a medication? What are red flag symptoms they should go to the ER for? How can I prevent getting sick the next time around? Like, in my mind, whatever the topic is, I'll break it down to 2 or 3 points that is going to actually impact that person and be actionable. And then they may ask you something that, you weren't expecting about, but the good thing is you would have done the work and you will be able to answer it. The funny story is I literally had this interview, and I think this was like in 2022. I was going to go on to talk about some COVID variant and whatnot on one of these news channels. And I kid you not, the anchor comes on. It's like, Dr. Durrani is here to talk to us about the role of psychedelics in treatment of depression. And I was a deer in the headlights. No one told me about this topic. They had some type of internal issue or error or whatnot that was supposed to be a segment for the next hour block, and that was terrifying.
So did you talk about COVID or did you talk about mushrooms?
No, mushrooms. I mean, I was there. It was live TV, so I gave the most non-answers of all time.
That's really funny. We only have 1 minute, but I want to touch on something. We chatted very quickly. It's really important for us as a company, and we do this work as an innovation team to support the next generation of providers. And you actually specifically from your role as a leader, as thought leader, were able to provide some guidance to a medical student after they got worried seeing Elon Musk said going to medical school is a waste of time. Can you just provide some more or some more about what happened there?
Yeah, absolutely. So, I mean, I'll rewind back to 2016 when Jeffrey Hinton said in 5 years we won't need radiologists. You shouldn't go to radiology residency and whatnot. And as of last year, radiology is still like a top five competitive specialty. We need more radiologists, and AI has been in that space for longer than any other space. So, what I tell medical students and what I truly believe is that AI is going to fundamentally change medicine. It's going to change how we practice, how we interact with patients, how patients interact with the healthcare system. That being said, it's very difficult for AI at 2 a.m. for a patient coming into the ER who gets, that scan that says, non-specific finding, correlate clinically, and I call the radiologist and we have a discussion about what I'm seeing, what they're seeing, and we come up with a plan. And so AI is not going to replace the physical physicians having that conversation, talking about a case, and making decisions. AI is going to change how we practice medicine in many ways. I use an AI scribe. AI is detecting pneumothoraces on X-rays and alerting me, things of that nature. And so if you're a medical student or someone going into the space, your job is going to be there, but don't ignore AI. It's going to be a fundamental part of how you practice medicine. So know how to interpret various types of AI, know what, good algorithms are, bad algorithms are, what hallucinations are, have a say in it, have an input in it, but go to medical school for the right reasons.
Yes, yes, totally agreed. Man. Unfortunately, that's all the time that we have left. Dr. Durrani, thank you so much for joining us.
Thank you so much.
Bye. And next up, we have Dr. Natalie Davis. With 23 years of clinical experience as a pediatrician and primary care provider, Dr. Davis has practiced across a broad socioeconomic spectrum, from affluent urban neighborhoods to underserved rural communities in her home of Kentucky. In Western Kentucky, Dr. Natalie Davis saw more than just the statistics of early mortality and disease. She envisioned a roadmap to revolutionize healthcare. This vision led her to co-found PreventScripts, a platform that not only intercepts preventable diseases before they take root, but also redefines the patient-doctor relationship through technology. Dr. Davis, how are you?
I'm great. Thanks so much.
Good, good. Great to see you. And for the audience, I should let them know I see Dr. Davis pretty much every week as part of our Scrub Capital calls. It feels more like she's a coworker.
Yes, yes, that's how we met.
Yes.
And it's been a great experience.
It has, yeah. I talk about it a lot. For early stage healthcare companies, one of the main things that they need is to be able to work with clinicians in a practice, not only to get their expertise, but then also get that clinical validation and work out the kinks so they can more seamlessly go into the provider's workflow. So that's where I think we come in to be able to provide value. But Dr. Davis, the first question that I have for you is how does social media allow you to have conversations that are so important to your patients and their entire family's health?
I think that I have always had the tendency to want to sort of do this one-to-many kind of health communications, really just from my very early days, the early days of Twitter, the early internet Q&A sites in the mid 2000s. And I just was thinking through this question. That's how I first met Ron Gutman at HealthTap. And the reason he asked me to be on that early HealthTap advisory board was because he read some of my answers to pediatric questions on those early Q&A sites. And that was really sort of the beginning of my foray into entrepreneurship. And the really interesting thing about pediatrics is that kids have parents who are in charge of them, right? So parents influence everything about a kid's life. And educating the parents is a key, piece of the puzzle. It's probably 80% of ambulatory pediatrics is educating the parents about stuff. And when we started building our mobile platform at PreventScripts, I mean, we could see that parents were interested in mobile tracking. And I always knew as a pediatrician that the parents were really the key to successful behavior change. And
Mm.
that's why we started with our reference customer and our early customer actually in the family medicine clinics to be able to onboard parents and their teenagers simultaneously into our RPM programs, because we knew that's how we would have maximum impact. And we see parents often refer their teenagers because they want to have the child have their unique experience of having their own scale that connects to their own mobile app and to have their own monthly coaching sessions. So we really see the synergy of the entire family benefiting.
That's great. One thing that we talked about during one of our prep calls was how you're able to have it within the 15 minutes that you get with the patient and their family. You're having one set of conversations, but you're not covering everything that can be valuable for the patient. And then so you're able to touch on those things which can be really valuable through social media and things like that. Can you talk about what that is, how those two different types of content differ? And things like that.
Absolutely. I mean, I think one of the topics that parents really want to discuss that there's so many things in pediatrics, we can go down the gamut of the list of them, but nutrition is one of those absolute cornerstones of care that we don't have time to discuss, nor do we have the wherewithal oftentimes to, employ a nutritionist in our practices. So for me, what I really could see is that, you can hand a parent a Mediterranean diet handout, but that is absolutely not enough because parents go home, they promptly forget everything you said, the handout goes in the trash, and really families need continuous support in between visits in that blind spot. You see a parent or a child for their well check, and then a year later you see that parent or child for another well check. That is that blind spot of time, is when patients progress from pre-diabetes, obesity, pre-hypertension into full-blown chronic disease. So how we utilize that is we built out our platform to focus on American College of Lifestyle Medicine lifestyle pillars, or American Heart Association's Lifestyle Essential 8. Those are the same things. And we call them My Plans. And a patient might pick move more in the mobile app or eat less sugar. And then we basically built a 6-week program of prevent tips that help the patient iteratively meet that goal. And, patients may not have time for an hour-long webinar. They may not have a laptop at home that they have access to, but they are able to make actionable change over time. And we see that this produces in aggregate a 1.4 point reduction in A1C, 12% reduction in systolic blood pressure, and 82% of patients realizing a clinically significant amount of weight loss in our enrolled remote monitoring cohorts.
So I feel like I'm stating the obvious here, but it would be great to just be able to get it out there. Um, while there's overlap between your work as a pediatrician and primary care provider, PreventScripts is a different entity. But doing both allows you to thrive in your first principal mission of being able to help people improve their health. Can you just talk about that?
It's really automation is what I'm going for, giving that parent that sort of one to many, or how do I get all this knowledge that's just stuck in my brain? You
Yeah.
know, how do you get it to 1,000 patients and then 10,000 patients and then scale? How do you scale up to 1 million patients? And, you know, patients being able to set micro goals, meet those goals, self-track. And I think the key is having the primary care provider as the accountability partner. And we have lots of consumer businesses that are going like gangbusters, but patients don't want to disappoint their provider, and they might not feel comfortable utilizing a program that is paid for by their health insurance, for example. And so I see my role as not only helping scale up the company, but also helping educate about nutrition.
And there's a variety of things that you can talk about in social media through PreventScripts that are so valuable for the patient, but you don't have the time for one-on-one on one through all the patients within the clinic, including nutrition. And I think that gets into the overall theme of this event, which is, and I'm bringing this into a question, how does the Medfluencer fit into the patient's healthcare journey in 5 years, in 2030?
I think as a pediatrician, I really feel the pain of the vaccine misinformation very deeply. And we have a lot of challenges out there. We're seeing measles cases again, for God's sakes. And, it really gets back to a moral imperative. We as providers, we have our outrage. We feel this outrage about everything that's happening right now, or righteous anger is another way to put it. So for me, my role as a chief medical officer at PreventScripts is to really try to amplify our frequency, use my work as a corporate board member or keynote speaker, as an author to reinforce, my mission, which is to really influence the importance of upstream behavior change, and specifically in rising risk populations that we work with, 17, ages 13 to 74. We work in those ambulatory and primary care populations where our platform is normalizing blood pressure, blood sugar, and weight over time. That's 80% of healthcare costs right there. So that's my top priority. And I sort of see myself as a sounding board with this sort of omni-channel, presence to impact the most patients possible. We've just gone from 5 trillion to $5.3 trillion in healthcare costs. We haven't even made a dent. And in my mind, the only way to make a dent is to be working in these ambulatory and upstream populations.
Yep, yep, I love that. And we are unfortunately out of time, but to sum that up, what I really heard is by utilizing your experience as a pediatrician and primary care provider, but then going back to your first principles of how do I help patients as much as possible, wherever that is, being able to speak on social media and be the CMO of PreventScripts allows you to do that at a higher level, which I love. So, Dr. Davis, thank you so much for joining us.
Thanks for having me.
See you later. Next up, we have Eris Hanson-Cooper. Eris, if you can turn on your video and unmute yourself. Eris Hanson-Cooper is the founder and CEO of GenWell, a new women's health search and discovery platform built to counter the rise of online health misinformation by connecting users to trusted Medfluencer-led content, products, and care services. After nearly a decade building in digital health companies like Carrot Fertility, Optum, and United Healthcare, Eris is now focused on understanding what today's patients, the social media generation, are actually searching for and how social platforms are reshaping the path from discovery to care. Eris, how are you?
I'm doing great. Thanks for having me. This has been so fun to listen to all of the expert medfluencers we've already heard from. So very excited.
Thank you. And one reason why I'm so excited to have you, Eris, is this thought didn't even come into my mind before we spoke, which was there are certain demographics, certain patient populations who are looking to social media, TikTok, Instagram. In our futures reports, 40% of people are actively going to TikTok to get health information. But there's certain demographics and patient populations that are going here to get information as well as disease states. And you really opened my eyes to that. So first off, let's just start ground level. Who are the people who are utilizing these services more, and what are they searching for?
Absolutely. And it's a really fascinating question because when you start to think about looking at a patient population, you're like, oh, there must be one particular demographic of person that's doing this in high volumes. What we actually see is that it's very widespread, which I think actually talks to how large of an issue, particularly women's health has become in terms of access, in terms of getting specialty information, in terms of women feeling heard. We've seen traditionally, medicine has focused a little bit more generically in a lot of the eyes of the patient journey. That's definitely not by the fault of the medical industry itself, but we have short appointment times. Women's health is complex. There's less specialists who have been very specialty trained on women's healthcare conditions. But by medfluencers going online and starting to record themselves, there's a huge humanization component that has come forward to say, like, I'm a doctor, but I'm a human and I get it. Like, I'm with you here. And it's attracted an entirely new population of people engaging in healthcare discovery online. We're seeing age groups, in menopause, perimenopause, healthy aging and longevity all the way down to Alpha and Gen Z just wanting to set themselves up for success, but not having local resources and using their online channels when they're very socially native already.
Yeah, I find it with my own friends. Do ice baths for your health, then all of a sudden ice baths are bad depending on where you're at in your cycle. Then all of us, because of the cortisol spike, then I see another medfluencer say that ice baths actually don't cause cortisol spikes. So there's so much information that can be counter to what you've previously heard. I see it with my own friends. Can you talk about, because your platform is built on understanding what people are actually searching for. And then so you talked about menopause, perimenopause, just general health information. But from all of these searches, and we saw from ChatGPT Health in their white paper that they posted, about one-third of searches have to do with their own health. So people are really, really searching for this information. I was shocked that it was one-third. What does this tell us about the gaps in healthcare communication?
Yeah, I mean, big gaps are forming or have been forming, and now we're really recognizing them. One of the interesting things about the ChatGPT white paper that has come out, you'll notice if you actually break down some of that data, a large number of those searches are actually not to do with daily health questions, but in terms of claims reimbursements and what happens after visits and, the cost of care, denials, et cetera. How do you fight an insurance claim? Very big space there in terms of maybe not medfluencers, but I think a new generation of like billing fluencers is going to come out helping people navigate these solutions because AI is great, but there's experts that can tell you a lot about the intricacies. Of healthcare billing. So that's been really interesting too. And when we look at the people who are searching for health discovery on AI platforms like ChatGPT, I get a little bit worried because AI, as a lot of us know on this call, is going to be an impactful thing for generations to come. We're so excited about it. We use it heavily at GenWell because it has great correlative abilities that can happen really quickly. But it only allows you to give answers based on the context that it has. And health, we know, just has a million different pieces of context to make sure that you actually get that answer that's right for you. Your pre-existing conditions, your historical health records, your genetics, all of those things actually play into correct care. And that's where we get a little bit concerned about simple chatbots doing those real diagnosis pathways without the human in the loop. So at GenWell, we take a very medfluencer approach to inspiration and education, but ultimately our goal is always to get people back to a human provider, just better equipped with information in that pre-discovery pathway.
How is social media empowering patients especially women, to finally access the health conversations that matter most to them. And what's changed recently that's made this moment possible and also more important.
Absolutely. Women talk, which I think is one of the biggest reasons that women's health is such a thriving ecosystem on social media right now. And what it shaped was, these problems have always existed, but through social media, women and patients decided to start going online and asking questions to each other. That started in Facebook groups at first. It started on simple posts. Now it's full channels of videos. And by doing that, it shared awareness that you're not alone, that this is normal. It's not something, out of the ordinary. And now we're really having this moment where women are understanding their hormonal health cycles more. Women are understanding care pathways more simply by listening to other women who have had the shared kind of patient journey as them. And I think that has helped people engage more and feel more confident going in and actually pursuing different care opportunities. And it's given them the insight that you can't really just see any doctor to get some of the specialty information that you may need. So it's helped a lot in helping just the average consumer understand healthcare, which in America, it is complicated. There is no sugarcoating that. So we need those tools that helps younger generations, areas of lower health literacy, areas of lower access, actually get into those really end-to-end cycles. And social media has really, since 2020, sparked an entire generation of doctors willing and able to do that.
Yeah, I'm glad that you brought that up. The health access component is so important there. Being able to provide this important information to people who live in a healthcare desert. You have this, is your audio working?
What's that?
Okay, for some reason I lost your audio for a second. You have this 30,000 foot view of all these medfluencers. What are you seeing as the main priorities for them to start doing this? How is this beneficial for them?
Absolutely. There is a wide array, I think, of motivations right now that we see in the healthcare ecosystem. But every single person that we talk to has the same core motivation. Nobody went to medical school, spent all that time and spent all that money not to be helping people, which I think is where we're really excited to be in an industry where trust and safety and helpfulness are at the core of every decision that these medfluencers are making. Now, we say medfluencer very specifically because there are wellness influencers. Those are not the people we're talking about here. We are talking about these certified professionals who have done the accurate amount of training to be able to give, real high level still education to patients. And so, yeah, when we think about that, sorry, I just lost my train of thought. Can you repeat the full cycle question? I totally went off on a different train.
Happens to me a lot. We were talking about the main reasons that physicians start to get into this. And I think where you were getting at was because it allows them to do their best to be able to help patients improve their health.
Absolutely. Patient health improvement is at the core, but then we have to also recognize this is a business and it is a job, and we want our medical professionals to be able to thrive as well. You'd be very surprised. There's many medical professionals who do not make the income levels that it takes to break down their student debts. So if we can help them maximize the potential of growing their businesses, whether that is doing something online, whether that is private practice, how can we help them succeed and thrive? We all need them. And honestly, we need more of them to be succeeding and thriving. Dr. Durrani mentioned, Elon Musk saying doctors, no more. No, we need to incentivize younger generations to get into medicine. If not, we're going to see a shortage of pipeline coming up, and that's very, very scary. So we want to put in different structural systems that incentivize these younger generations to say, wow, medicine is going to be a great career for me. Not only do I get to fulfill my motivation of helping people, but I'm going to be a thriving business owner as well.
That's fantastic. That's a great way to conclude this. Eris, thank you so much for joining us. And last, we have Dr. Hilary Lin. Dr. Hilary Lin is a Stanford-trained, board-certified internist and CEO of CareCore, an AI-enabled platform building the e-commerce infrastructure for the creator clinician community. Oh, that's a good title there. She bridges the gap between academic science and consumer health as the host of the Longevity Show and author of the Longevity Letter. Dr. Lynn, how are you?
I'm doing great. Let's do this. Thank you for staying till the end, everyone.
Yes, thank you so much, everybody. Yes. Eris, one of the questions I didn't get to ask was how people are viewing things in 10-second forms. And here we are, 51 minutes in.
I
So,
know.
yes.
Attention span of Gen Z has gone out the window. So it's gone.
Yeah, I think I was listening recently to a podcast. It went from like 3.5 minutes to 47 seconds
Oh,
in the last 7 years. It's
that is nutty. Yeah, no.
that is a healthcare role. Yes.
We got to
So,
talk more impact. Every single second needs to have impact now.
right.
So
Yes. You've come from academic medicine to building your presence on social media and founding a startup for other creator clinicians. How do you see the role of social media in helping independent practitioners thrive in today's world?
first of all, it's a massive paradigm shift. I can't even emphasize how much it's night and day, like working in an academic center. Most of the time, they're very closely watching what you post on social media. I know some of my friends who work in those systems, you have to get everything approved. So they don't actually get incentivized to get out there. But you turn over to the independent side, and it's an entirely different picture. So the way I think about it is historically, we thought of a physician's reputation as tied to wherever they're associated with. Stanford, Mayo, Harvard, Cleveland Clinic, that's your signal of trust. But now we're in this world where something like 85, 90% of all healthcare information is transmitted through social media. People aren't really going to their doctors to get it. So trust in healthcare has decentralized. So patients now are looking for real people, individuals, not just logos of prestigious academic centers. So now that knowledge is growing and changing faster than ever, people really want to know what their specific clinician's opinion is about a specific intervention. And this is really helpful if you're an independent practitioner because you can use your social media presence not just as a simple marketing channel, it's literally your practice shingle. So, and I also wanted to talk about because this theme has come up a few times. It isn't just about marketing. It's also about moral injury. So like a lot of us have left traditional medicine not because we don't love the healing, but because we've been so heartbroken by the assembly line of traditional medicine, having 5 minutes a patient. And some of you who have been following me know that I was on track to be an academic oncologist. A lot of my colleagues, my classmates today who are on that path, they have 6 to 8 visits booked on top of each other every hour. And that's cancer patients. So that's real moral injury to a healer. So I think the role of social media is to highlight our personal brand, but it also gives us another way to give better impact and bring the mission back into healing.
And when you say that, I think of Dr. Casey Means,
Yeah.
uh,
She
who's
was
one
my
of the,
classmate. Yeah.
was she? Oh, I didn't know that.
Yeah,
That's
she was a few
so
years ahead of
fun.
me. Hmm.
That's great. But yeah, I mean, she was 3 months out from finishing her ENT surgical residency when she dropped out to start now we call it a longevity clinic.
Yeah.
Uh, that's cool. You stated that your goal is improving access beyond your clinic. Can you give us a specific example of someone who benefited from your content who would have never been your patient without that?
Absolutely. This actually just happened the other week where someone emailed me all the way from Australia with questions about his circadian rhythm because he's a shift worker and I obviously I can't see him legally as a patient, but I was able to actually give him some educational advice. You always have to be clear about education versus medical advice when you're doing this sort of coaching. But he inspired an entire series that I'll be releasing soon about chronobiology and Zeitgebers or things that tell our brains what time it is. So this is somebody who, we helped one another. I could help him through education, and he took away a lot of the education I sent him to practice in real life. And he helped me hopefully help thousands or tens of thousands of other people who are suffering from a similar problem.
That's great to be able to hear. It's also just fun to be able to communicate with people.
Oh,
So
it's so awesome. Like just to jump in real quickly, I went from practicing in person like a traditional doctor to practicing in telemedicine. I'm licensed in 7 states. And then now, my reach is all over the world, which is so fun. So,
that is so fun. And 70% of all physicians now are employed by a hospital group, but we do see specific specialties where it's almost the opposite. Optometry is one of those. And this actually reminds me, as we were getting ready for this event and promoting this event, we had a startup founder actually who had specific questions for Dr. Rhue. And so I was able to email her those questions and she was able to get those back. And so you're able to have conversations not just with patients, but with other founders, which is so great just in terms of being able to be on the cutting edge of technology. The next question that I have for you is you're a Stanford trained with deep expertise in oncology, neuroscience, and longevity. How does scientific rigor become a competitive advantage for physicians in the creator economy?
Yeah. I used to tell folks, like, I don't know, like AI is getting so good. Maybe we won't need the knowledge of clinicians anymore, despite all of our years of medical school. But I actually noticed, and I would encourage everyone to think for themselves. When you are scrolling through Instagram or something, what is it that you look for to validate someone's statements? And I have found myself literally looking up the influencer or the creator. Like I look them up, I see where they've been educated, I see what their experience is. And I'm like, that's so funny that, this is actually what's come out of all of this AI slop. So, you actually value the person and their education a lot more. So I think to break through the crisis of noise that we're experiencing, I think scientific rigor is the differentiator. So you don't want to infantilize your audience. You want to treat them as smart, intelligent people. You want to explain the background, the scientific mechanism as much as possible. I know it can be tempting to really simplify, generalize, create like a three-step protocol that applies to so-called everybody. But we all know that that's not true if you know how science and biology works. But the more you explain why there's nuances and also why science seems to change, like why is it that I might change my mind about, XYZ intervention from one week to another? It's because new information came to light and new information is always coming to light. So I actually think treating people as intelligent beings and showing that you are a learning, intelligent being it builds trust, it builds respect, and it builds loyalty that, will compete in a world filled with AI sludge.
So speaking of a world filled with AI sludge and our 10-second attention span, if you were to package how the Medfluencer fits into the patient's healthcare journey in 2030 to a soundbite, what is that?
Oh, I think by 2030, we will have solved the greatest tragedy in modern medicine. Highly trained clinicians spending their days acting like data entry clerks. So I truly believe that the Medfluencer model allows clinicians to operate at the absolute top of our licenses. So because of platforms like ours at CareCore and many others, which I'm sure will come to fruition over the next decade, clinicians will become not just operators, but also chief medical officers, architecting a person's strategy for their own health, not scribing notes or even filling the prescriptions or refills and orders. So I think that's the future. I'm very, very gung-ho and bullish about what AI, what the Medfluencer trend is doing for all of healthcare for all of us.
That's great. Dr. Lin, thank you so much for joining us.
Thank you.
And for everybody, thank you so much for joining us. I know I've had a fantastic time being able to ask these questions to the people that we were able to bring in, and I hope that you found valuable information as well. To be able to learn more about what we do, please look us up at VSP Global Innovation Center. We're more than happy to connect with our ecosystem so that we can do to be able to help you in the variety of different programs that we run. Thank you so much for joining us.